Hello, my name is Kathy, and today I'll be discussing how to use homeopathic remedies on ailments, continuing with kidney and bladder ailments starting with the letter F and G. But before I do this, I wanted to let you know that because I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Please refer to my How to Use Homeopathic Remedies video before using the material in this video. I'll be discussing how to use homeopathic remedies on specific ailments, but I've broken these ailments into categories for easier reference. I'll begin with ailments of the mind and emotions. Then I'll move on to ailments of the brain and nervous system. Then I'll address issues with your skin, nails, hair, eyes, ears, nose, teeth, gums, lungs, respiration, heart, blood circulation, muscles, bones, joints, esophagus, stomach, duodenum, small and large intestines, liver, gallbladder, pancreas, kidney, bladder, then ailments specific to women and specific to men, then issues of the hormones and the metabolism, and then homeopathic remedies on infections, infestations in the immune system, then issues surrounding fertility, pregnancy, childbirth, postnatal problems, and then homeopathic remedies that address special problems in infants, ailments and diseases in childhood, and special issues of adolescence, and finally, special issues of the elderly. Constitutional treatment involves treating the totality of the individual person. Everyone is a unique individual with a unique physiology that responds to substances differently. In homeopathy, it is recognized that people will react strongly to certain remedies, and as a result of this, they can be loosely placed into different categories called constitutional types. Homeopaths talk of, for example, phosphoric types. These are people who react strongly to phosphorus, or Arsenicum album types, those who react strongly to Arsenicum album. The belief is that people of one type share similarities in terms of body shape, character, and personality, and the sorts of diseases from which they suffer. As an example, nature-mere people tend to be pear-shaped, have a dark complexion, be fastidious and rigid in personality, and keep themselves to themselves. And they also crave salt and suffer from constipation. As another example, lycopodium types tend to be tall, ganglion, of stooped appearance, with an anxious expression and a craving for sweets and a propensity to produce intestinal gas. Now, of course, constitutional types have their limitations. In reality, each person is an individual, and so there are as many constitutional types as there are human beings. An account must be taken of the sum total of the person's inherent predispositions, past illnesses, diet, general reactions to the environment, intellectual and emotional features, and general attitude towards life. This is what is meant by constitutional treatment. I'll be making detailed videos of the various constitutional types after I've completed the use of homeopathic remedies on ailments. The ideas, procedures, and suggestions in this video and all my homeopathic videos are not intended as a substitute for the medical advice of a trained health professional. Consult your physician before adopting the suggestions in this video. If you're pregnant, do not attempt these techniques without the approval of your physician. So, let us continue with learning how homeopathic treatments can help with kidney and bladder ailments, starting with the letters F and G. In the average adult, the kidneys filter the total volume of the blood nearly 300 times a day, producing about 1 liter or 2 pints of urine, passed on 4 to 6 occasions. As urine is produced, it filters into collecting ducts in the neck of the kidneys and trickles down the ureters into the bladder. As soon as the bladder is half full, its total capacity is about 1 pint. Stretch receptors in its wall signal the urge to urinate. After the age of about 4, the sphincter between the bladder and urethra is under voluntary control. The male urethra, which acts as a passageway for semen as well as urine, is nearly 4 times as long as the female. This and the fact that its opening at the tip of the penis is well removed from the anus explains why men are less susceptible to urinary infections than women. Unfortunately, the short female urethra provides bacteria with a relatively swift invasion route to the bladder. Urine, the sterile product of the non-stop filtering activities of the kidneys, is 96% water and 4% organic and inorganic solids, and its color can be a valuable guide not only to the function of the kidneys, but also to the state of the liver and gallbladder. The kidneys regulate the amount of water and also the balance of acid and alkaline constituents in the blood. And on those two things, all the chemical functions of the body intimately depend. Inside each kidney, the branches of the renal artery subdivide into 1 million or so tiny tufts of blood vessels called glomeruli. Small molecules, water, salt, various minerals, glucose, and waste such as urea, which is a product of protein breakdown, squeeze through their walls and under pressure and enter 1 million adjacent tubules called nephrons, which selectively reabsorb them. In a healthy kidney, 99% of the water and all the glucose are reabsorbed. This reabsorption process is controlled by hormones made in the pituitary gland at the base of the brain and in the adrenal glands that sit on top of the kidneys. The kidneys themselves produce a number of hormones that help to control blood pressure, stimulate production of red blood cells in the bone marrow, and activate vitamin D. Frequent urination. Urinating more frequently than usual is quite normal in cold weather, in the first and last trimester of pregnancy, and in moments of anxiety and excitement. Frequency of urination also tends to increase in old age. Tea, coffee, alcohol, excessive vitamin D, and certain drugs, especially diuretics prescribed for high blood pressure and heart disease, also make visits to the toilet more frequent. The disorders most commonly associated with frequent urination are diabetes, which is wanting to pass urine at night, feeling thirsty, losing weight, tiredness, itchy genitals, irritable bladder, uncontrolled urgency, involuntary leaking of urine, prostate problems. If the prostate is enlarged, the flow of urine may be weak and difficult to start, with dribbling afterwards. Urethral stricture, which is a stream of urine weak and reluctant to start, with only small amounts passed, and cystitis, which is overwhelming urge to urinate, urine passed in trickles that burn and sting, dull pain in the lower abdomen. See the individual entries for the specific homeopathic remedies for these conditions. If none seems suitable, try the remedies below. However, if the frequency continues, see your doctor. Specific remedies to be taken every 4 hours for up to 3 days. The person is elderly and suffers from frequency of urination all the time, day and night. Use Causticum 6C. The urge to pass urine strongest around 4 a.m. Difficulty starting the stream. Use Carb 6C. Frequent urging associated with constipation and irritability. Use Nux 6C. Intense urging, dragging pains in the lower abdomen. Use Lilium 6C. Glomerulonephritis, Bright's disease. Inflammation of the tiny filtering units in the kidneys caused red blood cells and proteins to leak into the urine. If blood and protein loss is severe, as it tends to be in children, nephrotic syndrome may be developing, and some degree of anemia. If many filtering units are affected, preventing the kidneys from efficiently regulating composition of blood, high blood pressure may develop, and as waste products accumulate in blood, kidney failure becomes a possibility. Symptoms are smoky or red urine passed in small amounts, puffy ankles due to the fluid retention, nausea and vomiting, abdominal sleepiness or drowsiness, and generally feeling unwell, and may fairly suddenly or insidiously over months or years. Since the condition affects every aspect of the metabolism, see a doctor within 12 hours if the above symptoms are present. The orthodox approach is to treat the inflammation, fluid retention, high blood pressure, and anemia with steroids, diuretics, and hypertensive drugs and iron, respectively. In severe cases, a blood transfusion may be necessary. Constitutional homeopathic treatment is recommended in chronic cases. As a temporary measure, until treatment can be arranged, take Arsenicum 6C 4 times daily for up to 7 days. Specific remedies to be given every half hour for up to 10 doses in acute cases while waiting to see the doctor. In the early stages, symptoms mild but include fluid retention. Use Apis 30C. Burning pains in region of kidneys, pain passing urine or inability to pass it at all, especially after scarlet fever. Use Cantharis 30C. Fluid retention all over the body due to loss of protein through urine. Person thirsty for sips of cold water. Chilly, restless. Use Arsenicum 6C. I have a great many videos now on many different topics, and so I've decided to make several different video playlists so that it's easier to find the videos of greatest interest. So please check out my playlist page. Well, that's it for now. To stay up to date with my latest videos, make sure to subscribe to this free YouTube channel by clicking the red subscribe button right below this video. Take care.